Hello, today we will be discussing the purpose and use of birth control, specifically oral contraceptives, IUDs, or intrauterine devices, and birth control implants. Before we give our presentation, we would like to give a sensitive content warning as we will be discussing reproductive and sexual health. To give a brief overview of our presentation, viewers will learn to understand the purpose of birth control. We will discuss 3 types of common birth control methods: oral contraceptives, intrauterine devices, and birth control implants. We will also explore payment methods of birth control. First, we will do a pre-presentation quiz of the content to consider throughout the video. For the first question, true or false? Oral contraceptives are effective in preventing sexually transmitted infections and are the most effective birth control. Next question. True or false? Sperm survives in the cervix for up to 5 days. Third question. Intrauterine devices are only for those 18 years or older. Question 4. The implant is inserted under the skin. And lastly, question 5, what is not a side effect of oral contraceptives? A, changes in your period, B, weight gain, C, nausea, and D, sore breast. So first we'll be discussing birth control. What is birth control? Birth control is also known as contraceptives. It is the use of medication, devices, or surgery, and/or methods to prevent pregnancy. And here sort of illustrates different types of birth control or contraceptives. What is the purpose? Birth control may be used to stop unplanned pregnancies, safeguard against sexually transmitted illnesses, enable people to take charge of their reproductive health, and enhance health outcomes. It's important to know with birth control that making educated decisions regarding one's reproductive health requires understanding the function of birth control. How are they typically used? Some different types of birth control are pills, inserting a device, barrier methods such as condoms. Specific methods depend on individuals' preferences, medical history, and lifestyle. So who can get contraceptives? Anyone who is sexually active and wants to prevent pregnancy could consider with their healthcare provider different types of methods. So when discussing with the provider to determine the best type of birth control method that fits your needs, it's important to consider age and health, plan for pregnancy, side effects or risk, frequency of sex or number of partners, privacy, as well as benefits such as lighter or predictable menstrual cycles. What types of contraceptives are available? Prevalent types include 1, oral by the mouth, 2, intrauterine devices, and 3, implants. So first, oral contraceptives are also known as the pill. They're taken daily by mouth, and so with this pill, it's important to take it at the same time every day. They include hormones that suppress ovulation, thickens the cervical mucus to keep sperm from accessing the egg, as sperm survives in the uterus for 5 days, and thins the uterine lining to decrease the likelihood of implantation and the cause of pregnancy. Common side effects of oral contraceptives include headache, nausea, mood swings, breast tenderness, and spotting or breakthrough bleeding, so changes in your period. When should you call the doctor? When there's severe headache, chest pain, shortness of breath, leg swelling, severe abdominal pain or bloating, severe mood changes and depression, severe allergic reaction, missed pills and late periods, or any other unusual symptoms. Next, we'll be discussing intrauterine devices, or IUDs. They are small T-shaped devices inserted in the uterus. They can be hormonal or non-hormonal. They work by preventing fertilization or implantation. Common side effects include mild cramping, irregular bleeding, changes in menstrual bleeding, acne, mood changes, and nausea or dizziness. Non-hormonal IUDs are Paragard or copper IUD, and they prevent pregnancy for up to 10 years. They function by impairing sperm motility and irritating the endometrium. And so that action sort of prevents fertilization and implantation. They can be removed at any time, and it will not affect fertility. And fertility returns after the IUD is removed. It can be inserted postpartum as well. And some possible side effects include cramping, menstrual pain, and heavy bleeding. Hormonal IUD include Mirena, and it includes hormone, which is only progestin. It prevents pregnancy for up to 7 years, and it functions by thickening mucus in the cervix and thinning the lining of the uterus, as similar to copper IUDs. And similarly, it can be removed at any time and will not affect fertility and can also be inserted postpartum. Possible side effects of hormonal IUDs include cramping, breast tenderness, acne, irregular bleeding, and mood changes. When should you call the doctor about signs and symptoms about IUDs? When there's severe pain and cramping, heavy or prolonged periods, signs of infection such as fever, chills, or unusual vaginal discharge, expulsion, which is when you feel that the IUD has fallen out or dislodged, or if you suspect pregnancy.
Implants. Implants are small, flexible rods inserted under the skin of the upper arm. It releases progestin, prevents ovulation, and thickens cervical mucus. It prevents the sperm from reaching the egg. Some of the side effects that include irregular bleeding, menstrual bleeding changes, headache, nausea, weight gain, skin changes like mild acne. And continuing, hormonal would be Nexplanon, which releases progestin. It prevents pregnancy for up to 3 years. Functions by thickening the mucus of the cervix and thinning the lining of the endometrium. It can be removed at any time. It will not affect fertility. Fertility return after implant is removed. Insertion is relatively painless, as physician will utilize a local anesthetic prior to insertion. It takes approximately 2 minutes or less. Some of the possible side effects include irregular menstrual bleeding, acne, mood changes, may bruise site of insertion, and potentially scar tissues. Wait 7 days after insertion before having sex, or use another contraceptive method, such as condom, for those initial 7 days. When should you call a doctor? If you have fever, chills, unusual vaginal discharge, severe pain or cramping, heavy or prolonged bleeding, unusual lumps or swelling, changes in vision or speech, or if you suspect pregnancy. These are some of the emergency contraceptives. There's a pill, emergency contraceptive pill, must be taken 120 hours or 5 days after unprotected sex. Pills with ulipristal acetate, or ELA, need a prescription, most effective type, and not as effective for more than 195 pounds. If you're more than 195 pounds, it's not as effective. Pills with levonorgestrel or Plan B one-step, take action, My Way, option 2, Preventenza, Afterpill, My Choice, Aftera, eContra, and others do not need a prescription, works best within 72 hours, may not be as effective for more than 165 pounds. Emergency IUDs are a copper intrauterine device. It's the most effective type of emergency contraception. Must get within 120 hours or 5 days. Weight does not affect it. And here are very effective, that are okay, and least effective types of contraceptives. So the most effectives are intrauterine device, or IUDs, and implants. The middle one that are okay to use are hormonal rings, oral contraceptives, and contraceptive injections. Least effective types are diaphragm, condom, or pulling out method, or tracking your cycle method. How can you pay for contraceptive? Your insurance may be able to cover your contraceptive. Health insurance marketplace plans must cover contraceptive methods and counseling. Covered contraceptive methods are barrier methods such as diaphragms and sponges, hormonal methods like birth control pills and vaginal rings, implanted device like IUDs, and emergency contraceptions and sterilization procedure. Medicaid and Title X sliding scale may be able to pay for your contraceptives. Here are some of the takeaways. Birth controls or contraceptives are the use of medication, devices, or methods to prevent pregnancy. Consider your individual preferences, medical history, and lifestyle with your provider. Different methods of birth control include pills, intrauterine device, or implants. Pills are taken daily by mouth. Intrauterine device are the most effective and prevent fertilization and implantation. Implants are inserted under the skin of the upper arm. This is the post-presentation quiz. We will go over some questions. So our question 1 was, it's a true or false? Oral contraceptives are effective in preventing sexually transmitted infections and are the most effective birth control. The answer is false. Oral contraceptives and other birth control methods are effective in preventing pregnancy, but do not protect against STIs. Moving on to question 2. Sperm survives in the cervix for up to 5 days. True or false? The answer is true. Sperm can survive for 5 days in the cervix. Question 3. True or false? Intrauterine devices are only for those 18 years or older. The answer is false. Intrauterine devices are for all ages and can work for multiple years. Question 4. The implant is inserted under the skin. True or false? The answer is true. Birth control implants contain progestogen and are a small piece of plastic to prevent ovaries from releasing an egg. Question 5, multiple choice. What is not a side effect of oral contraceptive? A, changes in your period. B, weight gain. C, nausea. D, sore breasts. The answer is B, weight gain. Oral contraceptives may cause weight changes, but not intense weight gain. Question 6. Pause and take 2 minutes to answer this question. List 2 reasons why birth control may be beneficial for you. And here is our contact information of UI Health 55th and Pulaski Health Collaborative. If you have any questions or concerns, please call at the number below. Or come to our hours, clinical hours, Monday through Friday, 8 a.m. till 5 p.m. Thank you. We want to thank the entire staff at UI Health and Pulaski Health Collaborative for welcoming us and allowing us to provide this information to their clients. And here are our references. Thank you so much.